Welcome to the Deep Dive. Today, we're taking a close look at something that really touches all of us at some point. And how do we keep our minds, well, healthy when our bodies are not feeling so good? It can be really challenging terrain. And I'm joined today by someone who can really guide us through it with a lot of compassion and insight. Our exploration is actually inspired by a very personal story about dedication to a mother's recovery after a bad accident, but also by some really timeless wisdom from the Buddha himself.
Thank you. Yes, it's a privilege to talk about this. You know, the Buddha is often called the supreme physician and surgeon. It's a title that I think beautifully captures his deep understanding of health, both physical and, importantly, mental. And the core teaching we'll explore today, it comes from this ancient text, the Nakula's Father Sutta. An elderly man, Nakula's father, he was often unwell, and he asked the Buddha for guidance. The Buddha's answer was, well, incredibly simple but powerful. Though my body is sick, my mind will be healthy. Now, Nakula's father didn't really ask for more detail then, but luckily for us, one of the Buddha's main disciples, Venerable Sariputta, he later explained the full depth of that statement. So over the next little while, we'll kind of cover three main areas. First, what does mental health really mean here, from a medical angle and a Buddhist one? Then we'll get really practical. What concrete steps can you actually take when you're sick? And finally, we'll touch on prevention and maybe even the bigger picture, ultimate freedom from sickness itself.
Okay, let's unpack that first part then. When we talk about being mentally healthy, well, physically unwell, what does that really mean? How do those different viewpoints, medical and Buddhist, help us understand it?
Yeah, that's really the foundation, isn't it? So from a medical standpoint, being mentally healthy when you're sick mostly means not being overwhelmed by excessive negative emotions. Things like huge amounts of stress, crippling anxiety, deep depression, constant fears, just nonstop worry. Now, it's really important to stress it's normal, it's human to feel some of this when we're ill. We're not aiming to be emotionless robots, but it's when these feelings become excessive, that's when they're really harmful. Medical science, neuroscience, they consistently show this. Too much negativity actually makes recovery harder. Whether it's diabetes or recovering from a heart attack or a stroke, it physically impacts your body's ability to heal.
Right. It's not just in your head. It has real physical consequences.
Yeah, exactly. Now, the Buddhist perspective, it goes a bit deeper, you could say. It defines mental health as being free from the spiritual poisons. These are traditionally listed as greed, hate, which definitely includes anger and spiritual ignorance. And it's crucial to understand what spiritual ignorance means here. It's not about not knowing worldly things like which doctor is best or a medicine's side effects. It's ignorance of deeper truths. The Four Noble Truths: karma, rebirth, impermanence, non-self, suffering. These fundamental aspects of existence. Because when we're driven by these poisons, greed, hate, this deeper ignorance, we tend to break ethical guidelines, generate unwholesome karma. And that, interestingly, can also block our physical recovery.
That distinction is really fascinating, and it brings to mind that powerful metaphor you sometimes use, the one about being shot by two arrows. Could you tell us more about that? It seems to capture this difference perfectly.
Ah, yes, the Arrow Sutta, or Sala Sutta. It's a very vivid teaching. The Buddha explains that an ordinary person, when they experience physical pain, they also experience mental pain. It's like being shot by two arrows.
Two arrows. Ouch.
Exactly. The first arrow is the physical illness, the physical pain itself, unavoidable sometimes. But the second arrow, that's the mental suffering. The worry, the fear, the resentment, the why me, all linked back to those spiritual poisons. Greed, hate, spiritual ignorance. A wise person, however, when struck by physical pain, only feels the impact of one arrow. They experience the physical sensation, yes, but they don't add that second layer of mental anguish fueled by those poisons.
So they don't shoot themselves with the second arrow, so to speak.
Precisely. And this distinction, it's also incredibly important for another reason, especially today. When the Buddha talks about mental illness in the scriptures, he's referring to these spiritual poisons. He's not talking about what we understand today as clinical psychiatric disorders like the depression, anxiety disorders, or schizophrenia that I treat in my clinic as a psychiatrist.
That's a really vital clarification.
It is, because understanding this difference helps reduce stigma. If we wrongly equate these spiritual poisons with modern mental health conditions, it adds this unfair layer of spiritual blame or shame. It can make people even more hesitant to seek the professional help they might need. I often try to explain this very simply, like I did with my mother after her accident. Just simple phrases: body sick, mind not sick. Or keeping the mind clear and still. Focus on clearing the mind poisons.
Body sick, mind not sick.
That sounds tracks.
Okay, so we understand the goal, avoid that second arrow. How do we actually do that? When we're feeling unwell, maybe our energy is low, what are the practical steps?
Right, the how-to. That's where the wisdom meets daily life. I find there are 5 key practical ways that can really help improve mental health when you're physically sick. The first one is cultivating loving kindness, or what we call metta in the Buddhist tradition. Psychology might call it fostering a positive vision. One way I love to teach this, especially here in Malaysia, is by adapting our familiar folk song Rasa Sayang. We change the lyrics slightly. It becomes, may I, may you, may all be safe, healthy, and happy. You can just hum it quietly. Maybe add some gentle hand gestures, sending out these wishes.
That's a lovely adaptation, using something so familiar.
It makes it accessible, you know?
Yeah.
First send it to yourself, then loved ones, then maybe even difficult people, then all beings. I remember teaching this to a patient. She was really anxious about a stomach scope procedure. While waiting, instead of just worrying, she sat there silently singing this Rasa Sayang metta in her mind, radiating it to the doctor, the nurses, the other people waiting. She told me later it completely changed her state. She felt calm, peaceful, and the benefits of metta are well known. Better sleep helps the body relax, calms the mind, improves relationships. It's quite powerful. And closely linked to this is observing ethical guidelines, the 5 precepts. Things like not harming, not stealing, mindful speech. If we're careless with these, especially when sick and maybe irritable, we can create more problems for ourselves. Mindful speech is a big one. It's so easy to complain excessively or speak harshly when we don't feel well, isn't it?
Definitely. Or gossip, or just, negative talk.
Exactly. But remember, our speech is action. It's karma. It shapes our mind. So even when ill, try to focus on words that are beneficial, agreeable if possible, truthful, and, importantly, spoken at the right time and place. Wholesome speech supports a wholesome mind.
Okay, so loving kindness and mindful speech. What's the second practical way?
The second is embracing the joy of gratitude. This means consciously focusing on what went well, even when you're surrounded by difficulty or discomfort. It's cultivating the mindset of, well, it could have been worse, luckily.
Finding the silver lining, even a tiny one.
Yes, and it's not about denying the difficulty, but balancing the perspective. I had a quite severe bout of food poisoning recently. Ended up in my own hospital, actually. The pain was, well, intense. But even then, lying there, I consciously practiced gratitude. Okay, this is bad, but it could have been worse. Luckily, I was near the hospital when it hit. Luckily, my good friend was free to drive me. Luckily, they had 1 room left, Luckily, my gastroenterologist friend was on call to manage my case. And luckily, this was a big one, this intense pain, like all things, is impermanent. It will pass.
That takes real presence of mind in that situation.
It's a practice. Same with my mother's accident, which was very serious. The natural tendency is to focus on the trauma, the what-ifs, but I deliberately shifted. Okay, it's bad, but it could have been so much worse. Luckily, a kind passerby saw her and called the ambulance immediately. Luckily, she was initially sent to a hospital where I work, even though it was the wrong branch at first.
So even the mix-up had a silver lining.
Yes, because they could contact me easily and I could redirect the ambulance to the main center where I knew my colleagues could give her the absolute best care. Focusing on these luckily points, it changes the feeling from helplessness to, well, a kind of proactive hope.
That's incredibly powerful. Moving from gratitude then to another big one when we're sick. Fear. How do we handle that?
Yes, the third strategy is transforming fear. Because fear, worry, anxiety, they are definitely second arrows. They only worsen any physical condition. Remember Nakula's father lying there thinking he was dying, his mind was full of worries. Will his wife remarry? What about the kids? His spiritual practice. And his wife, very wisely, didn't just say, don't worry. She addressed each fear calmly, logically. reassuring him point by point. And that brought him peace.
So addressing the fears directly.
Yes, acknowledge them, but then transform them. One very powerful method is to bring to mind the triple gem, the Buddha, his teachings, the Dharma, and the spiritual community, Sangha. Taking refuge in these, I personally find it helpful to visualize the Buddha, maybe in the Abhaya Mudra, the gesture of fearlessness.
Yeah.
That specific hand gesture literally means have no fear. Just holding that image can bring a sense of protection and calm. And another thing I learned during my own hospital, stay with that food poisoning. Sometimes when you're really physically weak, your mind just doesn't have the energy for active, positive thinking,
Yeah, it feels like too much effort.
Exactly. But what I found incredibly soothing was simply listening to Buddhist chanting. I just put on some recordings. Venerable Indiratana's chants on YouTube are wonderful. My mind was too weak to think positively, but just listening. It became so peaceful. I fell asleep easily. I even had this lovely dream, felt like heavenly beings were visiting, and I woke up actually smiling.
Wow, just by listening.
It bypassed the tired thinking mind and went straight to a deeper level of calm. It was a real lesson. Now, related to fear, especially in our modern world, is the information overload trap. Dr. Google wrote.
Oh, yes.
Yeah.
The midnight rabbit hole of symptoms.
Leads to what I sometimes call the idiot syndrome, internet-derived information obstructing treatment. You read all sorts, get terrified, maybe even doubt your doctor, my advice. Use the internet cautiously as a guide, maybe for questions to ask, but not as the final word. Find a doctor you trust, someone patient who will explain things. Or, if that's difficult, do good deeds, cultivate good karma, and maybe talk things over with a wise friend who has some medical understanding to get a balanced perspective. Don't let fear, fueled by misinformation, take over.
Sound advice. Okay, that's transforming fear. What's number 4?
Fourth is simple but vital. Relax to the max. Stress hormones, we know they worsen just about every physical condition. So active relaxation is key. There are so many ways. Meditation, of course, the Qigong, gentle yoga, maybe self-hypnosis, even light physical exercise if appropriate. My own mother, she's practiced Qigong for over 20 years. Even after her accident with her leg injury, she adapted her practice. It shows real dedication and belief in its benefits.
That's commitment.
It is, and you can add a spiritual flavor to these practices. While doing Qigong movements, for instance, you could silently repeat, body is sick, mind is healthy, or even hum the Rasa Sayeng meta lyrics. May I, may you, may all be safe, healthy, and happy. It helps keep the mind anchored in the present in a positive state. And if you're looking for guided practices, I actually have a free online course called Kindfulness. It combines mindfulness with loving kindness available on YouTube. Just simple practices to help relax and cultivate kindness.
I'll make sure listeners can find that. Okay, loving kindness, gratitude, transforming fear, relaxation. What's the 5th one?
The 5th ties it all together, really. It's focusing on what you can do. There's a core Buddhist teaching called anatta, or non-self. Sometimes people misunderstand it to mean we have no control at all, leading to fatalism. But that's not quite right. It means things are not fully within our absolute independent control. Many factors are at play.
Okay, so not no control, but not total control.
Exactly. So when you're sick, accept there are things beyond your control. The illness itself, maybe side effects, how long it takes. Let go of agonizing over those. But then consciously shift your focus to what is within your power. What actionable steps can you take right now? Finding a good doctor, learning about your condition and treatment options, practicing the Dharma meditation, reflection, observing those ethical guidelines we mentioned, actively cultivating loving kindness, making wholesome choices moment by moment. It's about switching from, oh no, what else can go wrong, to, okay, what can I do right now? Focus on your present actions, your present karma, rather than getting stuck on past causes or future worries. There's a line in the Dhammapada, in an ancient collection of sayings, health is the highest gain. It implies health isn't just passive, it has to be actively gained through wholesome effort, wholesome actions.
Focusing on agency, on positive action. That's a really empowering note to end the practical advice on. These 5 points offer so much, but they seem most relevant when we're already unwell. What about building resilience before that happens? How do we prepare ourselves when we're feeling healthy?
That's a very wise question. Prevention is always better than cure, right? And absolutely, the 5 methods we just talked about, loving kindness, gratitude, transforming fear, relaxation, focusing on action, these are fantastic prevention tools too. Practice them when you're well. But we can add a couple more layers specifically for prevention. First, something quite important. Normalize sickness. We need to cultivate what I like to call a psychospiritual booster mindset. Tell yourself regularly, it's normal to be sick sometimes. It's okay to be sick. Actually, it can even be healthy to be sick. In fact, it can be useful to be sick.
Useful. How can being sick be useful?
Yeah. Well, think about it. This mindset prepares us mentally. So when illness does inevitably strike, because it will, for all of us, it's not such a huge shock or crisis. We've already accepted it as a possibility, a part of life's package, and useful. Well, my own recent sickness, that food poisoning, it really helped me reconnect with empathy for my patients. As doctors, sometimes after years, you can become a bit detached, you know?
You see it every day.
Right. But feeling that physical misery myself is a sharp reminder. It makes me, I hope, a more compassionate doctor. Sickness can teach us empathy, humility, the preciousness of health. It reminds us to live more mindfully when we are well.
That makes sense. A difficult teacher, perhaps, but a teacher nonetheless.
Indeed. The second prevention strategy is to actively cultivate supportive actions or good karma while you're healthy and have the energy. This means consistently practicing things like taking refuge in the triple gem, really trying to observe the 5 precepts, meditating regularly, learning and sharing the Dharma, doing service for others, making donations, basically living ethically and compassionately.
So building up spiritual credit, in a way.
You could think of it like that. Why do some people, when they fall ill, seem to find good doctors easily, respond well to treatment, have great support, while others struggle, bounce from one ineffective treatment to another? From a Buddhist perspective, I believe past and present supportive karma plays a really significant role. Good actions create conditions for good results, including finding the right help when you need it. Imagine getting sick and suddenly a kind friend knows the perfect specialist and helps you get an appointment right away. That doesn't just happen randomly. It's often the fruit of past connections and kindnesses, past good karma ripening.
So investing in good actions now is like investing in future support.
Exactly. And then there's the ultimate perspective, the ultimate goal. Total freedom from sickness. We have to be clear. The only way to be completely free from all physical and mental suffering, including illness, is to achieve enlightenment. Because as long as we're caught in the cycle of rebirth, sickness, aging, and death are part of the deal.
That's a very long-term goal for most of us.
It is, absolutely. But it's the ultimate aspiration. We should encourage ourselves to aim for it. Even reaching the first stage of enlightenment, called stream entry, is incredibly significant. It guarantees enlightenment within 7 more lifetimes at most. Knowing that such a path exists, that complete liberation is possible, gives profound meaning and hope, even if we don't reach it in this life. And if full enlightenment seems too distant right now, a worthy aspiration is to be reborn in a heavenly realm as a deva. Physical sickness is much less of an issue there. But, and this is crucial, even in heavenly realms, one isn't permanently free. You still need to practice the Dharma to avoid falling back into lower realms of suffering eventually. The work continues.
Okay, that brings up a really important point then. If enlightenment, or maybe a heavenly rebirth, is the ultimate freedom, where does that leave all these very practical, very down-to-earth daily practices we spent most of our time discussing? Loving kindness, gratitude, relaxation. What's their role in light of that ultimate goal?
That's the vital link. These daily practices are not separate from the ultimate goal. They are the path. They are the steps we take on that journey towards enlightenment. Yes, they provide immense relief and support right here, right now, helping us navigate this life's difficulties with more grace and less suffering. That's incredibly valuable in itself. But they are also the very means by which we purify the mind, cultivate wisdom and compassion, and generate the positive karma needed to progress towards that ultimate freedom. So the big aspiration enlightenment, it gives context and deep purpose to these daily efforts. It transforms them from just coping strategies into active steps on a path of liberation. They work together.
What an incredibly rich deep dive this has been. We've really covered so much ground, from the fundamental understanding of mind healthy, body sick, through to very concrete actions anyone can take. Cultivating that loving kindness, maybe humming Rasa Sayang Metta, practicing gratitude for what went well, transforming fear by remembering the triple gem, or just listening peacefully, relaxing the body and mind, and always focusing on positive action. What can I do now? These feel like such practical, empowering tools for navigating not just illness, but really all of life's ups and downs, and connecting them to that larger journey. That's quite profound.
Indeed. The path shown by the Buddha offers both immediate relief and the promise of ultimate, lasting freedom from all suffering. It's about continuously engaging with these teachings, putting them into practice day by day.
A really valuable thought to carry with us, isn't it? How our small daily efforts to cultivate well-being, kindness, gratitude, presence are actually part of something much larger, a journey towards lasting peace. Perhaps something for all of us to reflect on. How can we weave these insights more deeply into our own lives?
And perhaps we can end with that wish we practiced earlier, a wish for everyone listening and for all beings. May I, may you, may all be safe, healthy, and happy.